Ever get that feeling? Like, when you stumble upon something new, something interesting, and the whole world kind of opens up a little bit. That's what we're all about here at the All Sorts podcast. We're like your guides, taking you on these deep dives into all sorts of topics. It's about making those complex things out there, well, not so complex. And today, we're going to tackle something super important. Diabetic retinopathy. We're talking symptoms, causes, the whole shebang.
That's right, a deep dive indeed. We've gathered a ton of info on this, and we really want to make sure you, the listener, come away with a solid grasp of this condition, especially, its impact on folks living with diabetes. We don't want to bombard you with jargon, but we do want to give you the knowledge you need to take action.
Okay, so let's break it down for everyone listening. Diabetic retinopathy, to put it simply, it's a complication that comes with diabetes, and it messes with the back of your eye, the retina. And why does that happen? Well, high blood sugar, if it sticks around for too long, it can cause some real damage to the blood vessels back there, the ones that keep the retina healthy. And what's really crucial to grasp here is that if you don't manage this, if you leave it untreated, it can have some pretty dire consequences. We're talking about potential vision loss, maybe even blindness.
Right on the money, but, and this is a huge but, there's hope. If you catch it early and manage it carefully, you can dramatically lower those risks. Mm-hmm. By understanding this condition and being proactive, you're essentially taking control of your vision, your eye health.
Okay, so before we jump too far ahead, let's get back to basics for a sec. What exactly is this retina we keep talking about, and how does diabetes, interfere with how it works?
So, the retina, you might already know this, but it's this layer at the back of your eye. It's sensitive to light. Think of it like the sensor you find in a digital camera, right? It captures all that light coming into your eye and turns it into these electrical signals. And then those signals, they zoom off to your brain, which is where the magic happens, turning those signals into images, the stuff you see. Now, for this whole thing to work properly, you need a constant supply of blood. And that's where those tiny blood vessels I mentioned earlier come in. They're like the lifeline of the retina.
And that, I'm guessing, is where high blood sugar throws a wrench in the works, yeah.
Exactly. Over time, if your blood sugar is consistently high, which is kind of a hallmark of diabetes, it can unfortunately start to damage those tiny, delicate blood vessels in your retina. And from what we've gathered, this damage, it's sneaky. It kind of develops slowly, over years even, before it gets to the point where it's seriously threatening your vision.
So it's not like, boom, sudden problem, more like a slow burn, right? Makes sense. Now, I know we've got different stages of diabetic retinopathy outlined in our research. Can you walk us through those?
Of course, of course. So the progression of this condition, it's usually broken down into, stages. And it's important to understand what those are. First up, you've got what's called background retinopathy, or sometimes you'll hear it as non-proliferative diabetic retinopathy, NPDR for short. In this early stage, little bulges start popping up in those blood vessels. We call them microaneurysms. It's kind of like, imagine a weak spot in a hose, right? It might start to bulge a little. And sometimes those tiny bulges, they can leak a bit of fluid, maybe some blood. The good news is, at this early stage, your vision is usually unaffected. It's actually quite common in folks with diabetes. Now, when you go for your regular eye checkup, the doctor, they might spot those microaneurysms. They might also see these things called cotton wool spots, which are basically little swollen areas and sometimes even minor bleeding, which we call retinal hemorrhages.
So at this point, you might not even realize anything's up, huh?
A lot of the time it flies under the radar. But, it can be silently progressing. Mm-hmm. Then you've got the next stage, pre-proliferative retinopathy. Sometimes you'll hear it called severe NPDR. Now things are starting to get a bit more serious. The changes in those retinal blood vessels become, more obvious, more widespread. There might be more bleeding in your eye, and sometimes those vessels can actually get blocked off entirely. And when that happens, certain areas of your retina, they're not getting the blood supply they need.
That sounds a bit more concerning. What comes after that?
Well, the next stage is called proliferative retinopathy, or PDR. This is when your body, in a way, tries to play catch-up. It realizes those blood vessels are blocked, the retina isn't getting enough blood, so it tries to grow new vessels. We call this neovascularization. But here's the thing. These new vessels, they're not the best quality, kind of like shoddy plumbing, They're fragile, they can break easily, and when they do, they bleed into this gel-like fluid that fills your eye, the vitreous. This is called a vitreous hemorrhage. On top of that, you might also get scar tissue forming alongside these new vessels, right on the surface of your retina. And sometimes the vitreous can stick to that scar tissue. And over time, this can lead to something pretty serious, retinal detachment. Now, this stage, PDR, it can cause some pretty significant vision loss, impacting both your central vision and your peripheral vision.
Yeah, that doesn't sound good at all. And I know our research also mentioned something about problems with the macula, right?
Absolutely. That's another big one to be aware of. You see, diabetic macular edema, or DME, sometimes called diabetic maculopathy, it can happen at any stage of retinopathy.
Yeah.
What happens is fluid from those leaky blood vessels, it seeps into the macula. Now, for you listening, the macula, it's the central part of your retina. It's responsible for that sharp, detailed vision you use for reading, driving, recognizing faces, all the important stuff. And when it gets swollen with fluid, think of it like a sponge soaking up too much water. It causes your vision to blur, to get distorted. It's actually one of the most common reasons for vision loss in folks with diabetes. And then you've got something else called macular ischemia, which is basically when the blood vessels in the retina, they close up shop, cutting off the blood supply to that vital macula area.
Wow. So the impact on vision can be pretty diverse, ranging from those tiny leaks to, full-on blockages and even these flimsy new vessels growing. Now, earlier you mentioned that early stages, they often don't have any noticeable symptoms. So at what point do people start realizing something's off with their vision?
That's a really good question. And it's precisely why regular screenings are so important. Because in those early stages, you might not feel a thing. But as things progress, as that retinopathy gets worse, some symptoms might start popping up. You might find your vision gradually getting worse, or maybe even experiencing sudden vision loss, which can be really scary. You might start seeing floaters, those little dark spots or streaks, kind of like cobwebs, that seem to drift across your vision. Blurred vision, distorted vision, those are common too. Some people describe it as patchy vision, where some areas are clear and others are blurry. And some folks even experience eye pain or redness. Another thing to watch out for is difficulty seeing in the dark, what we call night blindness.
Those are some pretty clear red flags, things you definitely don't want to ignore when it comes to your vision. Are there any other warning signs people should look out for?
Oh yeah, there are a few more. Changes in your color vision, for example. Colors might seem faded, less vibrant than usual. You might get blank spots or even dark areas in your field of vision. Or your vision could be fluctuating, going from blurry to clear and back again. Some people also report being more sensitive to light or glare. Now, it's really important to emphasize here, these symptoms, they could point to diabetic retinopathy, sure, but they could also be signs of other eye conditions. So the bottom line is, if you notice any of these changes, don't wait, don't brush it off. Get yourself to an eye doctor, a healthcare professional, as soon as possible. Don't wait for your next scheduled checkup.
Makes perfect sense. Early detection, it really seems like the name of the game when it comes to protecting your vision. So how do they usually go about detecting this condition?
The gold standard, the way we catch it early, is through diabetic eye screening. This involves getting a comprehensive eye exam, and I'm talking about the dilated kind. See, those early stages, they often don't have any noticeable symptoms, so these screenings are designed to catch any problems before they start messing with your vision. Generally speaking, they recommend these screenings every year, or maybe every other year, for anyone with diabetes who's 12 or older. Now, how often you need them might change depending on your previous screening results. As for the dilated eye exam, well, they use these eye drops to widen your pupil. This basically gives the eye doctor a much wider, clearer view of the inside of your eye, especially the retina.
So those eye drops are pretty crucial for getting a good look back there. Are there any other tests they might use?
Yeah, depending on what they see during that dilated exam, they might do some other tests. One important one is called optical coherence tomography, or OCT. Basically, it uses light waves to take these detailed pictures of your retina, like cross-sections. It helps doctors measure the thickness of the retina and spot any swelling, particularly in that macula area we talked about. There's another set of tests that focus on looking at the blood flow in your retina. We've got fluorescein angiography, or FFA, and then there's the newer one, OCT angiography. With FFA, they inject this fluorescent dye, usually into a vein in your arm, and then they take pictures of your retina as that dye travels through the blood vessels and helps them see if there are any blockages, any leaks, any abnormal new vessels growing. OCT angiography, it's kind of cool because it's non-invasive. It lets them visualize that blood flow without having to use any dye.
So a combination of these tests, it paints a pretty clear picture of what's going on in your eye. Now, who's most at risk for developing diabetic retinopathy? Who should be extra vigilant?
Well, based on our research, anyone with diabetes, any type, is potentially at risk. That means folks with type 1, type 2, even the less common type 3C, and of course women who develop gestational diabetes during pregnancy. But some things can make you even more likely to develop it. One big one is how long you've had diabetes. The longer you've been dealing with it, the higher your risk. Another is those persistently high blood sugar levels. When it's harder to manage your diabetes, we can measure that with something called hemoglobin A1C, high blood pressure, high cholesterol. Those are risk factors too. And believe it or not, even being pregnant can increase your risk. Also, your ethnicity plays a role. People of Asian or Afro-Caribbean descent, they're at a higher risk.
So managing your diabetes, that seems to be at the heart of it all. What are some specific steps people can take to prevent this, to protect themselves?
Absolutely. The best way to lower your risk, to slow things down if you do develop it, is to manage your diabetes like a pro. There are a few key preventative measures you can take. First and foremost, you got to keep those blood sugar levels in check. Aim for those target ranges your doctor gives you, keep things as consistent as possible, meet those A1C goals. And don't forget about managing your blood pressure and cholesterol. Those are essential for your overall health, including your eye health. Taking your diabetes medication exactly as prescribed, super important too.
And those regular eye screenings, I imagine those are pretty high up on the list too, right?
They're non-negotiable, honestly. Attending all those diabetic eye screening appointments at the frequency your doctor recommends, whether it's yearly or maybe even every 2 to 4 months in those early stages, that's what allows for early detection and timely treatment. And if you notice any changes in your vision, don't wait, don't hesitate, get medical advice right away. Another thing you can do is maintain a healthy weight. That means a balanced diet and regular exercise. Try to aim for at least 150 minutes of moderate aerobic activity per week. And if you smoke, well, quitting is one of the biggest gifts you can give yourself, not just for your overall health, but for your eyes too. Yeah, it's pretty amazing, but our research even suggests that in some cases, getting really good control of your blood sugar can actually improve your vision to some degree.
Now that's something positive to hold on to. But let's say the screening does find some problems. What are the treatment options at that point?
Well, usually you only need treatment if the screening shows something significant, something that's actually threatening your vision. In the very beginning stages, like we discussed, close monitoring and really tight management of your diabetes, that might be all you need. But as things progress, there are a few different treatment options that they can use to help you.
Could you outline those for us?
Sure. One common treatment is laser therapy, sometimes called laser photocoagulation. There are a couple of different types. You've got focal laser treatment, which they use to basically seal off leaky blood vessels in your macula. This helps to reduce that macular edema, that swelling we talked about. Then there's scatter laser treatment, or panretinal photocoagulation. They use this one for proliferative retinopathy, to shrink those abnormal new blood vessels that have grown in your retina. It involves making a pattern of laser burns across the retina. It's worth mentioning, though, that laser treatment, it can sometimes have side effects, like maybe some loss of night vision or peripheral vision.
And I remember reading about injections too, right?
Yeah, another key treatment option is injecting medication directly into your eye. Anti-VEGF drugs, those are used pretty often. We're talking about medications like Avastin, Eylea, Lucentis, those kinds. They work by stopping the growth of new blood vessels and reducing that leakage and swelling in your macula. This can help slow down vision loss and sometimes even improve your vision. Corticosteroids, those are another type of medication they can inject to reduce that macular swelling. And these injections, they're often given on a regular basis depending on how severe your condition is and how well you respond to the treatment.
What about surgery? Is that ever an option for more serious cases?
Yeah, if things are more advanced, particularly if you've got proliferative retinopathy or if there's a lot of bleeding or even retinal detachment, they might recommend eye surgery. Specifically, a procedure called vitrectomy. This involves surgically removing blood or scar tissue from the vitreous, that gel-like fluid inside your eye. They might do this if you've got a vitreous hemorrhage and it's not clearing up on its own, or if scar tissue is pulling on your retina, causing a detachment. Once they remove the vitreous, they usually replace it with a clear fluid or a gas. Now, it's really important to remember that while diabetic retinopathy is treatable, it's not always curable. Some of the damage, it might be permanent, and that really underscores the importance of catching it early, treating it early, to stop it from progressing and causing you to lose your vision.
This has been incredibly informative. To wrap things up, what are the key takeaways for our listeners? What should they remember about all this?
The big things to remember are that diabetic retinopathy, it's a serious complication that can come with diabetes. If you ignore it, if you don't treat it, it can lead to vision loss. But if you're proactive, if you manage your blood sugar diligently, keep your blood pressure and cholesterol in check, and go to those regular eye screenings your doctor recommends, and if you do find a problem, get it treated promptly, Well, you can dramatically lower your risk of losing your vision. You can slow down the progression of the condition.
So it's all about taking charge, being informed about your health.
Exactly. Your vision is precious. Taking these steps, it's like an investment in protecting it for the long haul.
On that note, as we wrap up this deep dive, we want to encourage you, our awesome listener, to keep exploring, keep learning right here with us on the All Sorts podcast on YouTube. Let that curiosity we sparked today lead you to even more discoveries. If you found this discussion on diabetic retinopathy helpful, we'd love it if you'd share it with others who might benefit. Hit that like button, it really helps us out, and subscribe so you don't miss any of our future deep dives into the fascinating world of knowledge. We've got a whole library of past episodes just waiting for you, covering all sorts of topics. And don't forget, the All Sorts podcast, it's not just on YouTube. We're on X, Instagram, Threads, the whole shebang. Join us there, stay connected, keep that flame of learning burning bright.
Couldn't have said it better myself. The quest for knowledge, it's a lot like protecting your vision. It's an ongoing journey, a rewarding one.
Thanks for joining us on this deep dive. We can't wait to explore new horizons with you on the next episode of the All Sorts podcast.